Welcome to this webinar. We're looking forward to having this conversation about the racial justice implications of climate change as it relates to children on the front lines. And really, once the video, it's a recording of the webinar that was transmitted last week, and so you'll hear an introduction from Nsedu Witherspoon, the executive director of the Children's Environmental Health Network. I wasn't on that particular call, so I wanted to just come in, greet you all, and watch it with you all, and then we'll have time for a bit of Q&A afterwards if you still have time at that point. But we understand if you have to leave early, it's about an hour long. So without further ado, we will start to run that webinar, and feel free to introduce yourselves in the chat, as I see already. Isis Sykes did from Highland Park, Illinois. I'm from Chicago, so anyway, welcome once again. Looking forward to having this experience and conversation with you all. We appreciate it.
Hello, everyone. Thank you so much for joining us. I'm Nsedu Obot Witherspoon, Executive Director of the Children's Environmental Health Network. And on behalf of the Children's Environmental Health Network and the Chisholm Legacy Project, Jackie Patterson is their founder and executive director. We really are excited to welcome you to our first inaugural webinar of our webinar series called Racism That Upends the Cradle. And this is a result of a report that Jackie and I pulled together and released a few months ago, and is the aim of taking a deeper dive into the issues offered in the report that gets into COVID-19, climate change, economic stress, and those very natural intersections and how they have and continue to, I'd say, plague our child health population, our marginalized, fence-sized populations, communities of color, and in particular, this report really takes a deep dive into the plight of Black children. So we can build a new future, one that embraces systems that enable us to all share in abundance and thrive together, supporting all children's futures. And that is really the uplifting message we're trying to have here, calling out the realities of where we are, evidence-based realities and people's personal experiences as our report lifts up, but also transitioning into the areas that we need to be, which is focusing in on those solutions that are actually in reach, that have shown evidence of proof in many communities across the country and even outside the US, that can and will continue to uplift our most marginalized, in this case, Black children. So today's discussion is taking a deep dive around children's environmental health, equity, and climate justice. And our speakers will explore the ways that children of color are hurt first and worst by the climate crisis, and how we can and must do better for all children. We selected this because we're in still Child Health Month, which is October, and October 13th was Children's Environmental Health Day, our 7th annual Children's Environmental Health Day that the Children's Environmental Health Network started as a day for and with our youth, our children, to really stand up for them, to show exemplary efforts, resources, partnerships, commitments that are making their lives safer, healthier, not just today, but into the future, and learning from our generations coming behind us, as we have much to learn from them as well. So a big thank you for joining us today and for the great work of Hannah and Christy at the Children's Environmental Health Network and the Chisholm Legacy Executive Team, Josie and Vicky. So I'd like to welcome our discussants today, and we're going to try to make this very informal. We were saying that if we were together, we just have, maybe a cup of hot chocolate, a cup of tea or coffee, and just be having these conversations in a real transparent form. So as you have questions, please start to load them into the Q&A segment of the platform for the webinar, and we'll definitely work those in the best we can. So I'd like to get into introducing our discussants here. We're really proud to have them all with us. Rhea Goswami is one of CEHN's 2022 Now Youth Leader awardees, and also co-founder and executive director of the Environmental Justice Coalition. Surili Sutaria Patel is a good friend and vice president at the Metropolitan Group and co-founder of Awaz for Climate. Jammie Albert is the Early Childhood Success Institute program manager at the League of Cities. Ladies, I'm really proud and honored to have all of you. You're all leaders in your own right, very, very important, the circles and spheres that you're working in. And we know that you all gravitate to protecting the most vulnerable as well. So really appreciate and look forward to our discussion. So again, as you have questions, load them up. But one of the first questions I had is, well, I'd like to have all of our discussants just kind of tell a little bit more about the great work you're doing, how your work is kind of intersecting between children and climate, and anything else you'd like to say as far as, the organizations that you're coming and or representing. So who would like to get started? Surili, would you mind kicking us off?
Not at all. Hi, everyone, and say thank you and to the Chisholm Legacy Project for inviting me to be part of this panel, or group of discussants, as Nse put it. I guess I got my entry point into the climate and health space many, many moons ago, when I was at the American Public Health Association. I was able to work with the wonderful members of APHA, who are pioneer and leaders in the public health space, particularly environmental health, including Nse, and really champion the idea that climate change isn't an environmental issue. It's really a public health issue. It's a health care, well-being, all of the above issue, and really moving that into a national conversation. And as I transitioned over to the Metropolitan Group, who we are a strategic communication firm that also does organizational strategy and innovation, intercultural engagement, and so on, I've been able to work with clients to really figure out what is at the root of, or at the intersection of climate change, health equity, and structural racism. And that you can't really separate those three out if you're really going to work on the issue of climate change and the disproportionate impacts, especially to those who we quote unquote call vulnerable, that include children, pregnant people, and the entire life spectrum of people. And the racialized impacts that we are facing because of past and contemporary systems and constructs and practices. And so I guess I fold into Avaz, with my colleague Seema Wadwa. She and I started a network called Avaz for Climate because we saw a gap and a need for both gender and racial equity in the climate and health space. And as moms, we also saw the power of the mom, the matriarch of a family, making some critical decisions about their family's well-being, and really connecting and talking to more people, but also more decision makers, household decision makers, on what it means to live a climate-friendly life, but also what the climate has in store for them, from energy justice to climate and weather impacts to allergy and asthma. So like everything in between. And so that's kind of my entry point, and that's who I am. And I'm really glad to have this discussion with you all.
Thank you so much, Surili. Really appreciate that angle. And Rhea, how about you? How did you start becoming such an amazing leader in your own right, and I know with your colleagues as well?
Oh, thank you. Yeah, it's always such an honor to be here. Thank you to the Chisholm Legacy Project for bringing and inviting us here. And I'm sorry that Natasha could not be here, but Natasha is my co-founder as well as the director of content at EJC. And the way that both of us really got started, but I got started was I did a lot of debate in high school. I did a lot of biology. And of course, like when the pandemic hit, a lot of high school things for granted, like this unprecedented amount of time to do whatever they wanted, whatever they liked with no bounds, really. And that's when I really started getting into activism as well as exploring youth empowerment and youth policy making. And through all of the boards I was eventually able to sit on and the people that I met, I realized like there was kind of like this space that didn't have youth voices, and that was environmental justice for us. At that time, I think I talked about this, I think, with Surili as well as Nse and a lot of our mentors, that environmental justice was kind of it was a term that everyone knew, yet no one wanted to acknowledge at that point. And because of the Black Lives Matter movement, so I have to give kudos as well to the progression of the Black Lives Matter movement during the pandemic, and how mainstream it became, it allowed environmental justice to come into the conversation. And that's really why, that's the foundation that I stand on today, to be able to advocate for the things that I love and the things that I want to care for. And so EJC stands for the Environmental Justice Coalition. And so we focus on empowering youth to become the climate leaders, scientists, and activists of tomorrow. And we especially recognize how youth have really critical skills as well as viewpoints that we can bring to the conversation. And a lot of the unique work and partnerships that we can do with communities to build up communities, as well as educate even younger, like future generations as well, through curriculums, education, and social media. So yeah, that's one of the unique things that we do is we really partner with organizations, as well as local organizations, to empower communities. And a lot of our work focuses on uplifting BIPOC and marginalized communities. So that's just a little bit about what we do. So yeah, I would love to give a shout out to my entire team at EJC, because without them, we wouldn't really have anything. So yeah, thank you so much, Nse.
Thank you, Rhea. And Natasha, your co-founder. I should mention Rhea is on her college campus and joining us in between classes. So we really appreciate that level of dedication and you know, really your leadership really is incredible. And we wanted to make sure that, you know, your voice and your mission is definitely heard. It's vital. And Jammie, how about you?
Yes, good afternoon. Thanks for having the National League of Cities and having me here today. And say, I'm already inspired just off of the introductions of what I've heard so far. As mentioned, I'm Jammie Albert. I am a program manager with the National League of Cities Early Childhood Success Team. For those who may not be familiar, at NLC, we represent the more than 19,000 cities, towns, and villages across the country, supporting city leaders through advocacy, research, technical assistance, and much more, really working hand in hand with them as they work to create for every city to be a thriving community. And I think in order for communities to thrive, they have to work for children and families. So I'm really excited to be a part of our early childhood success team, where we really work to make sure every city, town, and village is a place where all children reach their full potential, where them, along with their families, live safe and healthy lives from every stage of development, beginning prenatally up through that around that third grade, K through 8 level, as well as supporting the early childhood workforce. Personally, I'm excited. I'm a huge believer in community and that innovation happens at the local level. So that's why I truly enjoy being able to do these things with city government leaders, not just elected officials, but those day-to-day implementers and boots to the ground workers who have those strong partnerships and ties with the community. It's a different degree of accountability for local elected officials because you live amongst the people that you represent every day. So one of the things that I do primarily in our work on the early childhood team, my focus is that prenatal to age 3 developmental period and looking at all the things that impact them. And it's an area I'm always telling my colleagues, like, we touch every area of work across NLC. So whether it's our federal advocacy, our climate, our health equity work, our infrastructure work, it is the connection of human and physical infrastructure. So I'm really excited to lift up what we've been seeing cities do as they include children in their action plans and sustainability plans and climate change and all the impacts that all the connections in that. So I'm excited to be here for this conversation today.
Really excellent, Jammie. You really help round out a lot of these perspectives, especially when we're talking about the critical developmental stages of all children and how vital those stages are for future health and safety and growth and development. So thank you again for being here. All right, I don't see any other questions yet, so I'm going to launch into some of the ones that I was having for our discussion. So I know you're all familiar with the report, and of course that could just be a springboard. We don't have to limit ourselves by any means to the elements of the report, but the framing of our report, does get into, again, like I said at first, the challenges, the reality, what the data and personal, individualized and community evidence of practice and experience has shown for many, many decades now in the United States. So when we do think about this connection between children, equity, climate change, what do you all see as some specific challenges in protecting our most vulnerable, our children, from the impacts of climate change, especially when it comes to children of color, such as Black children? Jammie, you want to start this time? Yeah.
Sure, I'll kick us off. I think one of the first barriers when we think of that is that the fact that the intersections of climate change, environmental justice, and children's health, it's not brought to the forefront enough. I think that there's that mindset in all things, I think, that impact us broadly, is that the children are okay and they'll be taken care of. And so we often don't call it out specifically, the need for that. And that's truly one of the things that I really appreciated about the report, is how it immediately calls out the trauma and racism experienced by Black children from the womb. So before they even enter into the world, here's these experiences caused either by the natural and or built environment. And so I just think that's one of the first barriers, is that we're not explicit in naming it and naming the impacts on children and families. I do think there's been an increase in the amount, and I've seen it. I'll be fully transparent. I am immersing myself in getting more into the climate space more recently. So as I see it, I'm like, oh, this is amazing. And there's people like, we've been doing this forever. And I'm like, this is new to me. And it shouldn't be new to me, because the fact my work around children and families is not new. So I'm really excited to see, I see it more frequently, the research supporting that. And I think we're, as a society, we're really making the case more between environmental health and child development. When we talk about air and water, noise pollutants, access to nature, healthy food resources, we all know that affects the health and well-being of young children, but also that the proximity to those health services and space are vital for a good start in life. However, we do know that for families of color, and particularly Black children, the odds are stacked against them. They don't have that proximity and the closeness to that access. And even when I was thinking and looking at this, when you consider some of the suggestions to protect children from the impacts of climate change, the odds are stacked against them. When we suggest financing, enhancing the services for the things that children depend on the most, there's the barrier of historical lack of investments and support for the communities that Black children and children of color live in. When you look at the suggestion of reducing emissions and pollutions, we know that majority of Black families are 75% more likely to live in communities near an industrial site and suffer higher rates of asthma and all those things that negatively impact our health. And then there's the push to create more child-centric climate response plans. And I think in that, even when we talk about equity, racial equity, there's equity along the early childhood continuum. And a lot of time in those plans, if children are included, it's school-age children. It doesn't get to the more vulnerable population. I think it was yesterday, the White House released a fact sheet reporting on the administration's action for better school infrastructure. And so we look at, and part of that was calling for more energy efficient schools, but how do we bring those conversations down the pike? How do we start for our most vulnerable populations? How do we be explicit in calling out infants and toddlers? How do we get support to make childcare settings more energy efficient as we look at how we're changing things? We know that there's so much at stake in those first 3 years of life. That's the brick and mortar of brain development. But we also know the exposures and harmful outcomes of climate change. So how do we do those things that we're being preventive and not reactive during the most vulnerable time of life? So those are some of the things that stood out for me.
Excellent. And thank you for tying that right into some of the real opportunities, you might say, as well as continued challenges, because if we have time, we'll get into maybe some of the influx of support, capacity, money that a lot of these new laws passed that I know we're all happy about are potentially bringing in, especially to community level and infrastructure, early learning, and some climate related work. And yet these are very broad buckets. So I know we're also very focused, laser focused in ensuring that whatever we collectively can do to ensure that the agencies that will be receiving and have started in some cases receiving at state level these unprecedented amount of money into the millions and millions of dollars that are intended to go towards infrastructure in the broadest sense. We know, for example, lead piping, is explicitly called out, right? Replacement of lead piping for water infrastructure. And then there's a lot of gray area. I don't know about you all. I have read through some of these bills, or at least portions of some of these bills, and it's daunting, right? And it definitely leaves a lot of room for interpretation. So to your point, Jammie, about ensuring that we are explicit about, the impacts that early environments have not only in the trajectory of growth and development. I mean, if COVID-19 hasn't taught us this in this country, that parents, grandparents, caregivers need affordable, safe, accessible childcare in order to go to work. Even if work means on a Zoom screen, you need to be able to focus. I don't know what will, if that lesson has not yet been told. And certainly it's tried and true for our K through 12 schools for sure. Any space that our children are spending a predominant amount of their time, we need to be very much better at ensuring that we identify and quickly remediate so as not to repeat and repeat and repeat the same atrocities. And we do know that children are becoming sick in these environments where they're where they're supposed to be. They're spending time in places where we are encouraging them, we are dropping them, we are sending them to these places with the gross assumption that they are cared for. Not to say that people on site are doing these things on purpose. It's nothing anyone is necessarily doing. It's more what we are not doing. And I would say what we are not investing in. So I'll get off my soapbox and let you all discuss, but you triggered something right there, JV. Thank you. And Rhea, how about you? When we're thinking about, there are real challenges. Clearly, if this was easy, it would have been done already, right? And there are many layers of this onion, but where do you stand on some of these perspectives?
I think my perspective, I take in college, I take 2 classes actually about this exact topic. I take a class on environmental governance and I take a class about environmental justice of non-human and human world. So it's really interesting to kind of see how governance comes into practice. What Jammie was saying really struck a chord with me because it's a lot of what I see in literature that I'm reading. But in the case of this actual report, I think what really struck a chord with me and the work that me, Natasha, and a lot of EJC does is education. First of all, the importance of education and that children of color have access to these educational opportunities, resources, broadband access, and things like that. I'm literally sitting in a college right now. And that just, I think, goes to show how important education is for young people, as well as climate anxiety and grief. We talk a lot about this as young activists and kind of that aspect of climate doomism. So that's kind of just where I stand. But to start with education, I think it's really important, as Jammie was saying, and as you were saying, it's really important for children to kind of put a name to the things that they're experiencing and to not diminish or kind of cast away a lot of the traumatic experiences they're having from being in such a polluted environment or harmful environment to them. In a way, children shouldn't be able to see everyone in their family has asthma. They shouldn't be able to see that everyone in their family is getting lead poisoning. But to have a name and recognize that these experiences are valid and they are happening and there needs to be a solution done, whether at the city or the state level, it's something that I think kids really need. And as a person who grew up in the suburbs, it would have been really I think climate education is not something that has been emphasized. When I was in school, and even my younger sister, who's 6 years younger than me, we don't have climate curriculum readily accessible to us. It's often an elective or even just a push to the side. You get to do it senior year of high school. You get to even barely learn about geographical systems within schools, even understand the bare minimum of climate change. So I think again, education needs to become more environmental education and public health education needs to become more mainstream for students to be able to understand these traumatic things that are happening to them. And as well as for example, the lack of transit access is something that we've talked a lot about in Maryland. As some of you may know, the Maryland Red Line did get shut down in Baltimore. And that has been really hard for a lot of people because that limited job access, reaching school on time within the city because there's no actual public transport that is reliable within the city. So it's things like these. So for example, we're working with the Baltimore Transit Equity Coalition to make a curriculum to educate students on here are the injustices that are happening within your environment, and to be able to put kind of a name to the experiences that they're having, I think is very important. But on the disproportionate impact of climate change and grief, again, because communities of color as well as Black children are more affected by climate change, it's really important for them to have their mental health taken care of as well. And that, again, the aspect of climate doomism, anytime you open the news, it's often or sometimes when I open my LinkedIn, it's always the world's going to end by 2040. Climate change is getting to unreachable levels. No one's doing anything. And I think for example, I was talking to Ariel King, 2 weeks ago, and we were talking about the importance of joy and having space and time to recover and connect yourself with the environment. As my professor said pretty much yesterday, the reason why we're fighting for our climate is, yes, to have a safe place to live in, but also to enjoy being outside and enjoy being like connected to the environment without having to worry about being harmed by it as well because of things that we've done. So that's just some of the things. Those are some of the things that were going through my brain.
Yeah. Thank you. Thank you, Rhea. Surili.
Well, Jammie and Rhea said it all. I mean, just everything you said, yes, +1, etc. Where I'm coming at it is similar to both of you in that there is this, this sense that we all just show up to the work, to the space, exist in a monolith. But really, we have so much that is behind us, not just, our zip code, not just our ancestry, but also our access to, right? So that holds us almost back. And some more than others, right? And then on top of that, the actual current climate, the political climate, this is election season. We have early voting starting already in many states. There's also the conversation around, Rhea, you mentioned the movement for Black Lives. There's also, we're still in a pandemic. All these things kind of affect us, right? And then boom, climate change, which is like a constant. And so this syndemic, this idea of us kind of the aggregate of 2 or more concurrent harms to us as a society, let's just say it doesn't just cancel each other out, it adds on, it layers on and amplifies. So for children, particularly around climate, I, tend to empathize with Rhea in terms of eco-anxiety and climate anxiety. A couple years ago, I had the privilege of publishing a paper with my colleagues at APHA around this very topic and looking at ACEs and looking at adverse childhood experiences, coupling them with the traumatic experience of living through or knowing that you're in harm's way caused by climate change and there's nothing you can do about it. And we learned several things. Children of color, and by that I mean children who are Black, Hispanic, Indigenous, particularly, are at greater risk of these climate anxieties, and also simultaneously lack access to the services, to the attention, to what this actually means to their health. Mental health is often looked as if we get to it, we'll get to it. But we know with chronic stress, especially early on, it impacts development, it impacts cognition, it impacts the ability to thrive. ACEs, chronic stress, toxic stress over a couple years also impacts the ability to graduate with a high school diploma. So we're already, from the cradle, setting certain children up for less success than others. And Rhea, you mentioned climate anxiety, and I fully subscribe to that, especially when you're talking about immediate impacts like natural disasters or heat waves that you have to live through that causes types of anxiety, stress, PTSD, if you just had to live through it and you don't really understand what just happened. Why did it happen to my family? Then there's also the gradual impacts of climate events, right? That comes from slower progressing things like increase of spring season, which causes more asthma related or respiratory illnesses. So you're going to the ED more often because you may not have a primary care, or you may not have a pediatrician. And that's stress. That's the stress that I'm talking about chronically that hits students that can, impact their academic achievement because they may be missing school. They may have to choose between transportation to school or medication. The parents are making these tough choices. Then there's these indirect impacts. Hey, hurricane just wiped my town and now I have to be displaced. I have to go to a completely different city and start all over again. My ability to connect with the other students around me. I don't have my lacrosse team. I don't have my debate club. I don't have my community. I don't know who I am, that sense of self-worth, that economic insecurity that comes along with it. And we also know, based on climate refugees and migration, that when families are moved into a new community, they have to reestablish everything, including their access to care, their access to groceries, their access to educate, everything. So those social determinants of health, those wraparound determinants of what makes you healthy and whole as a person completely are evaded. And so I think mental health is completely underserved across this country, across a lot of contexts, because it's stigmatized sometimes, but also is one of those silent, just scary byproducts of the climate that we're facing right now. And what gives me hope, Rhea, I really enjoyed your points about having joy and hope, is kind of to remind moms and caregivers in general to make the time and space to heal, and that after an event or during an event, or even just at any point, take a moment and sit with, what you're going through, celebrate your wins, heal from your losses, and be in community with one another. Because in the absence of not just mental health providers, but culturally competent mental health providers, we are kind of leaning on one another. It really does take a village to raise a child, let alone take a village to raise the family that we need to be in. So I love the idea of joy, climate joy in general, and healing in collectives.
This is deep, y'all. Yes, Surili. Yes. I also, before I pivot us now towards case examples, solution-oriented frameworks, system approaches that you're a part of, that you are taking a harder look at, that you are seeing working, I do want to just lift up also, again, this generational impact. So it's not just this child by themselves. It's unfortunately generation after generation after generation of trauma and impact and trauma and impact. So, on one side, it is a well-known, maybe it's a stigma also, that, women of color are so strong and they're so resilient and they've taken on so much and so much of the family. Not to say the men have not, but there's a different type of expectation or a load of responsibility, right? And from the outside looking in, yeah, maybe so. But the reality is there are a lot of women of color who are suffering from the things you cannot see, right? Stress all the time you cannot see. It's an internal deterioration of your health and well-being. Maybe it impacts your mood and other things, but obviously it impacts everyone in different ways. Because that person is able to get up and go about their business and go and hold a job and bring money into the family and all these other key responsibilities and ways that they're showing up, time and time again, does not get to the root of generational trauma and the many other things that woman, who then becomes a bearer of a new being in many cases, then even unexpectedly is passing along to their child. So what we do know, the science, again, we're 30 years old now this year. The science has completely evolved and it still evolves, but we are standing on a lot more than we knew 10, 15, 20 years ago, 30 years ago. What we do know, mounting science continues to show us, peer-reviewed science, that pregnant women who are exposed, again, to these type of traumas that we're talking about and these implications that we're talking about at the intersections that we are talking about, who probably also were exposed much, much earlier in their lives, are, take heat index, rising heat index as just one indicator. So we do know that pregnant women who are exposed to higher levels of heat are resulting in higher rates of negative pregnancy outcomes, which then reciprocates into negative outcomes for a child that's just entered this world. So think about, again, Jammie brought up, it's like these constant pillars that you're up against, even with the best of intentions, even with an oodle amount of money, even with some great partners at the table, all of those together still may not, and unfortunately we've seen time and time again, really get to the root of changing the system of things, as we've talking about, to really turn this thing on its head and allow a whole new set of a new generation of people to start fresh and to not start with the legacy of all of this stuff, not to mention what they come in contact with each and every day. So on that note, I'd like to move us into some of the resources, the toolkits, again, evidence, best practices, as some may call it, that are truly making a difference. All right. We may not be there, right? This is we didn't get here overnight. The solutions are not going to be just quickly turn around in one night, week, month, year. But are we going in the right direction? Because I'm really tired of us constantly reporting on the growing increase of a variety of health outcomes, especially when it comes to the children we're talking about here today. So I'd love to hear from you all, being at the core of the work that you're in, with the passions and energy that you personally bring. Where are some examples that you think that they're at least turned in the right direction and getting it better than we've been in history past? Rhea, what do you think?
Yeah, I was gonna jump in actually. I think it's really important that now, one win that I've been seeing happening is that a lot of people, especially like state level lawmakers, are realizing the importance of protecting future generations. And I think that was something that was really understated, as Jammie was mentioning earlier. This trauma, and you too, Insight, this trauma happens from when these children are in the womb, and then as they go into the cradle as well. And so the fact that we need to protect future generations as well, and again, as Surili was mentioning, like having that stress as a mother, being like, is my environment even healthy for my child? So states are now recognizing that future generations need to be protected. So for example, I'm from Northern Virginia, so I work a lot with Maryland. So the Maryland actually, there's an environmental group within Maryland who is petitioning to add an amendment to the state constitution that says that all children, people who live within Maryland, as well as future generations, have the right to a safe and healthy environment, because it's a prerequisite to property, like the right to property, prosperity, and like the pursuit of happiness. So because it's a prerequisite to all of our fundamental rights listed within the Bill of Rights and its declaration, and like the Bill of Rights and the Constitution, this should be added. And I thought that was like a huge move in the right direction. And I think now they're still voting on it. EJC did help make an advocacy toolkit for them to help it get onto the ballot. So I think it was really impressive for me to see that states are now recognizing that this needs to be done. States like New Jersey, for example, have made models to make citizen scientists within communities. And as I really resonate with what Jammie was saying, in that grassroots organizers, community organizers, and city level organizers are really where some of the magic within climate change happens, because they know their community the best, and they're the ones who can really make those solutions. So because of that, I think I talked with Ariel the other day as well. Like when she was in law school, she used to work and have like seminars with the community members to really understand like what is happening in the community and how can they as lawyers with their education help them. And I think that's something that we need to do more. Like we all have so many resources, we have so many connections, yet really just kind of sitting down and talking with community members and really trying to understand like what is happening in their issues. I think something that we are now starting to do more, and it's really something that gives me hope that we can make solutions happen for them. There's also climate literacy is also increasing because of the advent of like all the effects of climate change. I think the importance of children having climate literacy as well as adults, to really understand what does it mean for carbon emissions to become zero? What does it mean to go green? What is land grabbing? What is green grabbing? There's so much jargon within the environmental space. Yeah, I can see activists like the queer, brown, vegan, who are actively breaking down these really heavy terms that have a lot of history, a lot of trauma, and breaking them down so that people can understand. I think we need a lot more of that energy within the space. So those are just a couple of my favorite projects that are happening right now.
Excellent, Rhea. Really appreciate you bringing up terminology. We talk a lot about effective communication, right? And totally agree. We should never assume that everyone's education of these topics is at the same level. And that certainly isn't a dig to anyone either. Everyone's extremely busy. These are complex issues in the current, nonetheless, to understand the history of it, right? As we're all still learning each and every day. So appreciate you reminding us that while we urgently move forward, we must not forget the core values of allowing people the time, the space where they're at to digest some of these realities so that everyone, because there's room for everyone, can figure out where can I best add my skill set, the little bit of time I have. Maybe I'm a retiree, I have a lot more time on my hands. We are in midterm season and there eventually will be another presidential election. We all know elections matter. We have a voter guide at the Children's Environmental Health Network, and I know there are many other resources for all of us to incorporate and encourage that candidates consider these topics, and for them to weigh in publicly and let us know how they feel about these topics, and if elected, what they would do with their platform, right? This is very critical at these times to know who we really are reviewing and electing into local, state, and of course, federal offices. Jammie, what are some of your thoughts on, I know you're working on some programs yourself directly and welcome those thoughts. And of course, any of those that have caught your eye along the way.
Yeah, thank you. I'm learning. I've been taking notes. I had to come back to the conversation. I'm like, oh, this is great. I just think so much of what's even been mentioned. Rhea, you talked about the work taking place at the state level. And I think it would be, I don't want to miss the opportunity to share the importance of government accountability and working together, those intergovernmental partnerships. We talk a lot about that in our prenatal to 3 work, because we can't do it in silos. No one can do it alone, but it really takes everyone working together. In the coming months, as we talked about my prenatal to 3 work, I'm really excited to kick off a body of work that really looks at the impacts of climate and environmental health on maternal and child health well-being specifically. So if you get a note from me following this in follow-up to bring you into the conversation to the fold, because that's how we continue to learn. And again, it's that connection of that human and physical infrastructure across. NLC has been working on this for quite some time right now, really working to ensure, and say you mentioned the influx of dollars and people needing to know what to do with it. Honestly, this is the first time with the fiscal, state and local fiscal relief funds that cities and counties are directly getting funding. And that has not traditionally been the case. And it's like, what do you do with this? And I think that's the power of Rhea, of what you said, of having those advocates to say, hey, let me tell you how this money can be spent. This is what's needed in our communities. So I'm really excited about the work that NLC does around that. I'll put some links in the chat as well before we close out. We have a local infrastructure hub that really makes sure cities are aware of those funding opportunities that are available to them to support things like flood mitigation. And say you mentioned lead remediation, which is huge when we look at the impact on infants and toddlers, especially in those legacy cities, those towns that were once booming steel mill industries and where paint factories are. And that has a large number of older homes built prior to 1970. All the things that are impacting their breathing and their everyday environment. So there's a lot of funding and supports around that. So I'll be sure to put a link in around our local infrastructure hub. I also would be remiss if I didn't mention, we have a partnership with Healthy Babies, Bright Futures, who does great work around environmental health and neurotoxins and their impacts on young children and families. There's a webinar next week focusing on how smaller cities, which is really important, because when we talk about cities, we talk about the San Franciscos, the New Yorks, and the Seattles, who have the capacity, but there are those more smaller cities and small to mid-town communities and rural counties that don't have that capacity to go after these funds. So I encourage you, if you live in those type of towns, encourage your local electeds to get connected and be involved with these things. But there's a webinar assisting them to access federal funding around lead remediation specifically. As I mentioned, we've been working on this. NLC, our City Solutions Department, really has been focused on climate sustainability and resiliency for quite some time. And we're really seeing cities integrate climate, environmental justice, and children's health into their general sustainability plans, which I think is amazing. And I'm always going to be the person in the background, what about the babies? What about the babies? And how are we? Because you have to say it. It has to be said. Again, you have to name it. So really looking at that and how are they making equitable transitions so that cities are greener and seen for all residents. I think that's the key piece when we think about that equity piece. Again, not just racial equity, but equity along the early childhood continuum as well. Some examples that I had pulled out about that, this Philadelphia launched an Environmental Justice Advisory Commission. And I think that's a great type of coalitions and different things like that are great to have, because it's committed to establishing grant fund for environmental justice and community resilience. The city doesn't always have to lead it, but how can they support it? And I think that's a key piece to keep in mind as well. In Baltimore, they really observed the excessive warming in their lower income neighborhoods. So they adjusted their climate action plan to address those inequities as well. There's tons of examples of cities really building and strengthening their communities to ensure children grow and have healthy lives. And so at NLC, within the Institute, we have our Cities Connecting Children to Nature initiative, and we've seen cities do great things. Louisville, Kentucky, and Austin, Texas have really centered equity as they work to improve children's access to nature. Rhea, when you talked about climate education, I think every parent, at first we cringe when our children first learn about recycling because they are on it and they are the biggest advocates, but just the things that we take for granted, that having them learn those things help them grow and change your household. When you teach children about urban gardening and how can we grow our own food, how can we plant trees, even though we don't have a lot on our street, how can we create these things and change our own environment? So lots of exciting things to share. And I'll put some of the resources to links to the things I just mentioned as well.
So helpful, Jammie. And it's so empowering to be hearing, states that are making a difference and it's not easy, right? To pull people together and to make these negotiations. And thank you for constantly being that voice, reminding folks that we cannot forget our children who don't get the ability to sit in these rooms and advocate on their own behalf. Surili.
I appreciate those resources. I'm learning a lot too. So I'm really grateful. I think what I would add to the conversation is close to what both Rhea and Jammie have said around education. What Metropolitan Group often does is work with groups to conduct narrative shift exercises, right? So here's, an example is the shift in climate change. The narrative shift around climate change, health equity, and social justice, and how that, it's not an equal, everyone may feel the climate impacts, right, once in their life, but not everyone will equally be able to recover or be resilient to them. And so how do we shift the mindset that, or the narrative that it isn't polar bears and ice caps, and that it is health, it is asthma, it is the difference between you earning a livable wage, it is the difference between you accessing, healthy, nutritious foods. It's all of that, and the intersectionality of it. How do you talk about it in a way that's tangible? Well, one of the ways we're doing this is for one of our clients, where we're helping create a just connection to elected officials at the local level, and using shared values. We start with common and shared values between electeds in conservative states and the advocates who are doing more progressive work, and finding what values they care for most. And while health is top of mind, so are children. You can't really argue when it comes to children. So having those shared values, how do you create programs? How do you pass local laws and ordinances so that we are keeping climate in the forefront? And sometimes it's not climate change that wins the argument. Sometimes we almost advise not to even say climate change in the conversation, but talk about the outcomes you wish to see in your community. And sometimes you can talk about the co-benefits, because a lot of these challenges that we're facing in the climate space, climate health and equity space, isn't siloed, right? Because of the intersectionality of all these topics, we could be talking about climate and housing. We could be talking about climate and safer schools, better school routes. There's so many different intersections that really are interesting. Something successful that I point to is happening in California. It's called the California Enviro Screen. It's a tool that helps identify households and communities that are disproportionately burdened through energy. So we now know that energy is going to be something of a necessity, especially when we're facing high heat. And in individual household energy impacts are astronomical. And so parents, family members have to choose between keeping the air conditioning on and paying their gas bill versus buying prescription medication or food. So energy consumption in the home is a huge issue, and it's disproportionately affecting people by race. Why is that a surprise? It's not a surprise. So when we're seeing residential exposures, we're seeing the only 3% of after tax income in households that are earning $50,000 or more annually. But energy expenditures represent 33% in households earning less than $10,000. Okay, so that's a class, that's an income issue. But when you break it down by race, we're seeing so many more. We're seeing 23% of white households and 56% of Black households who can't pay their energy bill. And this is a stat from 2020. So how do you reduce this energy burden? Well, there's a few other resources that are talking about this right now, including the Lancet Countdown. Just yesterday, the US Lancet report came out, and one of their solutions includes talking about energy, talking about mitigation. And so I encourage you to check out this report. It has several other recommendations based on the latest science and data collected in the country today. Another resource is A Vase for Climate. We have a vlog, we have a YouTube channel where we talk about the intersectionality of climate, health, and equity. And we talk about structural racism almost in every episode. Nsedu's on there, Rhea's on there, Jammie, we'll have to get you on there to really talk about what it is. And we have a ton of resources that each one of these amazing speakers come to and share with us. And so I also encourage you to check out the resources there. And the last thing I think I want to say is that when it comes to just making a shift in the case examples is really rooted in the individual, ultimately in the power to vote, the power to decide. And so I know we've talked about voting and it's election season, and it's so incredible to just understand that while national elections are super important, right? It's also critical that if you can vote, to go and vote in your local elections, because that's where decisions are happening about your school districts, about the greenscaping of your parks, about your access to transportation and how transportation is being brought to you, public transportation. So all these things, including criminal justice system, they're all happening at the hyper local level. And so while it's really exciting to watch the presidential election, it's even more exciting and important for us to be extremely active and engaged in our local elections.
Thank you, Surili. And that's a great pivot to our last lightning round here, because you've all been so informative. And I'll just also mention the Climate Equity Collaborative, which the Children's Environmental Health Network has launched this fall. It's more to come. It's helping me get for the first time to COP27 in Egypt in a couple weeks, which is the big United Nations climate summit meeting. And this will be the first time that we've held a children's environmental health focused program as part of the first ever environmental justice pavilion, which also is very worthy of gaining a lot of attention. The focus on justice, which has been environmental justice, climate justice, which was identified years ago at these meetings. So a lot of firsts, a lot of novel opportunity, a lot of networking we're going to try to do on the international stage and bring back what we can. But, there's a lot of domestic focus work here to lift up existing programs that, again, are making a difference and could use more leverage, could use more capacity, could use more money, could use more media attention, could use more partnership. That's one of the many ways that this Climate Equity Collaborative wants to help be a steward of these connections here, children, climate equity. So as we do our quick lightning round, Rhea, I thought maybe if you had 30 seconds with our participants, what would your mantra call to action be?
My call to action is always and will forever be being an activist is never one thing and never one-dimensionally one thing. Everyone can be an activist in their own right. I know we hit on this point a little bit, very briefly, but we all have the capacity. And sometimes activism can look like just even being up to date with what's happening in the movement and taking the time to understand these histories. And yet you'll still be better off in understanding and talking with your community. Even better, if you have a little bit more time, you can go talk to community members, join local organizations, and give funding to these people, or give even more valuable, give your time to these people to help these opportunities. We always need more volunteers, more groundwork. And even better, if you're a scientist, a professional, your expertise is always needed forever in everything that we do, because the climate change movement is so intersectional. We always, like, for example, there's a young person who who's interested in the climate movement. Mentorship is one of the most beneficial things that Natasha and I have had the privilege of having, and really guiding us through this movement and getting to know so many people, such as Surili and Say, and now Jammie. Like, it's amazing, the power of networking, as well as even just giving your expertise. Of course, public health has become so amazing in the intersection of environment, but now we're looking at finance with ESG, for example, and things like that. So I think everyone has a space within this environmental movement, no matter what age, no matter what background. But that's just my 30 seconds.
Excellent. Definitely kudos, support all of that. And I think we're all beneficiaries of all that you mentioned. How can you know to be involved or engaged if you don't at least have an opportunity to explore and being exposed? And that exposure pathway can come in many different ways. But like you said, just simple time really goes a long way to help shepherd, engage someone at any age, and especially our youngest, who have so much to give and so much skill set. And again, should not be shouldering the impacts of what has been created in this life for them. Jammie, how about yourself?
I just echo so much of what's been said. Ditto to Surili's points about those local elections. Please get out and vote, have your voice heard. My 30-second pitch, I just think as communities are developing these plans to enhance climate sustainability, it's critical that they are child-centric, have our most vulnerable populations in mind, starting with the earliest years of development, with houses impacting pregnant women, infants and toddlers, and historically disinvested communities that are vulnerable. Make sure you're keeping equity central. One thing we drive to our partners when we're talking about equity being central for early childhood success is we encourage our partners to always ask, who's benefiting, who's burdened, and who's missing from the decisions that you are making. And if you can't actively properly answer those questions, there are more people who need to be at the table. So continue to break down those silos and build connections between healthy development, climate, and justice. Get connected with organizations that you've heard here today. NLC is happy to be a partner, and continue to learn from one another. I've learned so much today, so I'm grateful for that. But let's continue to surface the impacts on climate and environment, on children and family, and surface those strategies so that we can improve outcomes.
Excellent. Thank you, Jammie. Thank you. And Surili.
Yes to everything Rhea and Jammie just said. Amazing. And I'll just add specifically to the people who are working in this, what makes our work especially difficult is that we're surrounded by social injustices and one crisis after another. And the swarm and the volume of information we find on the news and social media feeds can be super dizzying. And that there's no denying that injustices of the past are still being lived, experienced, perpetuated in contemporary forms that we can actually see and touch. And so to cut through the national debates and the ideological and political divides, I'm certain our work needs to reflect and should be rooted in the community experience and the expertise and wisdom of those who have been on this journey for much longer than I have, and that there's magic in the deep listening that we can do, whether it's with one another, whether it's with the communities we hope to work with and serve, whether it's with academic institutions, governmental agencies, etc., that there's magic in deeply listening and coming from a place of deep curiosity, authentic curiosity and concern, so that we can find a common ground, and that no matter how much health is seen as an individual challenge, it's nothing but that. And so too is the road to healing. So I just want to bring it back to say we do need to make time for our own healing so that we can help others as well.
Perfect. And we know we as women in particular talk about this often. We are no good to any of the work that we're passionate about if we can't also take the time needed to be there for ourselves. So wonderful point to start on. These are heavy, heavy issues. And I'm honored to be alongside all of you and your networks and the partners, and all of you that have joined us today. Because again, it's going to take all of us. I really hope that at least one point, if not a bunch like me, have really touched you today. And I really encourage all of you to do some deep, mentoring and meditation, and take a walk, think on some of these things. Again, there is a role for all of us coming out of this child health and children's environmental health time of the year. This is the whole point. There's always more work to do. There's more partnerships to engage, and we are all stronger together in meeting these achievable, in many cases, equity-driven, child-centric goals that will also benefit our climate's health. Thank you, with deep appreciation. Be well.
Wonderful. So we won't keep you all much longer, but yes, it was good for me to experience that with you all, and appreciate you, all of the wonderful chat exchanges, and just really appreciating Nse and Surili and Rhea, and I forget the other person's name, but who just shared so richly, and you all for enhancing it with your own reflections. So recognizing that you all shared so much in the chat, are there any other things that, yes, thank you, Susan, for that comment. It's so true. Any other comments that you all want to share or questions? I mean, we know that we're already quite over, but we just wanted to make sure. Okay, well, we can give it a wrap, make a wrap here. But I appreciate you all and look forward to, we'll again, make sure you all get a copy of this a link to this recording, and also a copy of the chat exchange, which again was so rich. So thank you all for joining us, and be well. Looking forward to continuing this journey with you all. All right, take good care.